They promised. They promised that they would eliminate cervical cancer in England by 2040, but time is ticking. The NHS committed to make this disease, this cancer of the mouth of the womb, a thing of the past. But how? After all, more than 500,000 women around the world are diagnosed with it every year. Well, one approach is screening, which aims to detect and treat cervical abnormalities before they become cancerous. But some women are less likely to go. And you guessed it, Black African women are among them. But why? Data suggests faith and culture may affect screening uptake. So I decided to explore how. First, I systematically reviewed the evidence to understand how women across the world view cervical screening through the lens of faith and culture. My results show choices are influenced by cultural taboos and stigma around sexual health, gender roles affecting whether women can or are allowed to go for screening, religious institutions, both in terms of what's practiced and what's preached. Then there are cultural norms around healthcare seeking, such as waiting for symptoms in order to validate a clinic visit. There are different beliefs about God and his role in health and illness, whether as protector, a healer, or a predestinator. Beliefs about chastity also have an impact because of what screening might imply. And let's not forget other factors like mistrust, modesty, and migration. So, having gathered a worldwide perspective, I wanted to understand how this applies in the UK. Q Stage 2, the Black Screen Study. I interviewed and held focus groups with Black African women across England, leveraging academic networks, third sector organisations, and my own community ties. Analysis is underway, but what next? All of these findings will need to shift from information to integration within screening services. To optimise this, I am planning a Delphi exercise where I will get an expert consensus on which recommendations should go into clinical practice. So, overall, my research will illustrate how women's religio-cultural worldviews influence how they look after their health, which might have implications beyond cervical screening. Healthcare providers can then use this insight to better cater to the needs of the populations they serve. And perhaps, just perhaps, delivering culturally appropriate, faith-informed care will help the NHS keep their promise. Thank you.